Now it's my pleasure to introduce somebody who doesn't really need an introduction, but has been at the forefront of this effort, our Deputy County Administrator for Health and Human Services, Ms. Joy Bivens.
Good afternoon, everyone. I know we acknowledged everyone, but I know my boo is in the room, so thank you, Mr. Mayor, for all that you do for the city of Whitehall. Thank you to the board, but I really also want to make sure that I thank the JFS team. Can you raise your hand if you were with, I'm sorry, the county HHS team. If you were with the county, would you please raise your hand and just thank you all so much. Thank you for working so hard on this. I don't know where you're at right now. Thank you always for working so hard on this. Thank you. And thank you, Yama. I know we've been very difficult. So thank you, Ms. Yama. You all need to give her 5 raises. So just really quick, I want to touch bases on One Door. One Door came out of, like Commissioner Brady said, the Poverty Blueprint Plan. When we were doing those conversations with residents, one of the things I did was I shadowed our residents that were walking into one of our JFS. There was a mom that walked in and the worker was at the desk and she called her number. She walked over and gave her number, and the woman handed over an obituary. And so because I was standing behind her, I intercepted it and I looked at it and I said, "Is this your son?" And the woman coupled over the desk and started crying. And so I went to grab her and have a conversation with her. And what she told me was, yes, my son was killed. He was killed by gun violence. He was 15 years old. I said, well, let me see, I'm trying to get him off my case. I'm trying to do all these things. My mom is in the car. I take care of my mom. I got to get back to work. And in that moment, I knew we needed to do something different. Health and Human Services needed to change. It needed to change for everyone. Because imagine her telling that story to every door she walked in. It's traumatic, right? Mm-hmm. It's traumatic to hear. So I have some of the dopest commissioners on the planet. And they are so dope. One of them even gave me the name of DCH Ching because they feel like I spend all the money. I don't, I really don't, right? So I went to them and I said, okay, out of the Poverty Blueprint Plan, the People's Plan, one of the things the folks said that they wanted something they can walk into and get all the things at one time. And so as we adopted this model, we implemented downtown our government center. The reason why we adopted it here, I originally looked at Capitol Park because I was scoping out the real estate there. I was like, I said, I see Dr. Muhammad. I said, no, you wonder why I'm stalking you. I said, you have some empty cubicles over there that I think we can utilize, right? But one of the reasons why we're starting this in our in this clinic is because we want to test the model. Imagine walking in, being able to pick up your prescription, but also you need a rent for your grandmother. Imagine walking in and seeing the doctor for your medical services, but at the same time, you want to make sure you have a workforce opportunity or check on your food assistance case, or whatever you can be provided in our brick and mortar. It eases access, releases burden, and reduces stress. Our Franklin County Commissioners are committed to every resident in every part of this county to ensuring that we are not just providing the resources as it is mandated by the state or whoever, but also making sure that we're doing it in a dignified way and that we are moving people up the economic mobility ladder. I cannot be more proud. I am so happy. This is personal for me, because I want to make sure that it doesn't just start here, but it starts, we duplicate this across the county and other places. And it doesn't hurt that you have 21,000 patients that supports the reason why I could place it here. Because some people were like, well, can you got 5 people. You got to be high traffic. It got to be a high traffic area. But I do want to make mention, there are some federal changes that are ahead of us. We have some tough challenges ahead of us. These Board of Commissioners have some tough challenges to make in the days ahead as it relates to budget. Resources like this, One Door being infused into a healthcare system, will assist many residents so that as they are making those decisions, there's more ease and folks do not fall through the crack. So we are excited. This is our first partner outside of the county government. I know we're going to Capitol Park because there's still some real estate over there. I do know we did provide, a case manager over at Primary One as well for their Medicaid services. Hopefully one day we can, duplicate those services there as well, because they have the number of patients as well. So again, thank you all so much. Thank you for believing in the vision. Thank you to my dopest commissioners on the planet, and I didn't spend any money. Did I spend any money, you all? But it's coming, Commissioner.